We are seeing definitely a big surge now in our COVID patients. Now, just to give an example with regards to death rates, at the beginning of summer, we were around 300 to 350 deaths a day across the country. At the height of the pandemic, which was last year, we were averaging around 4,100 to 4,200 deaths a day. We are slowly inching up, and my gut feeling is by September 30th, if 60% of the country's population is vaccinated, fully vaccinated, which we are right now at around 55%, we'll still see around 1,200 deaths a day on an average, which is still around 25%, 25 to 30% of what we saw last year, but that's definitely 4 times more than what we are seeing right now. So the rates will go up, and of course, first the cases go up, followed by, in 4 weeks after that, we see hospitalizations go up, and on average, 4 weeks after that, we see death rates go up. So we are at that stage of increased hospitalizations, and unfortunately, death rates also will follow. America currently is divided between 2 groups. One is a vaccinated America, and the other one is unvaccinated. And as long as we have a fair bit of the unvaccinated individuals, we will keep seeing new mutants, new variants keep coming, and that will probably, unfortunately, run the COVID pandemic as long as we do have unvaccinated individuals. In some of our sister hospitals, we just see completely unvaccinated individuals. And even among the vaccinated individuals which we see, they are with very, very mild symptoms. On my watch so far, nobody has really perished with regards to having a vaccine and had COVID. Of course, comorbidities also play a big part, like obesity, but now we're seeing more of a relatively younger population between the age groups of 35 and 55 getting the COVID infection. Last week, there were 250,000 new infections among school kids across the country. Now, of course, above the age of 12, we do have vaccines available for kids. So first of all, I would like them to, to get the vaccines. I'll ask the parents to ask their kids to get vaccinated. Second of all is the data which shows that less than 12 years of age, kids are getting infections from their adults. So I would suggest even if people do not want to get vaccinated, do not want to wear a mask, I would say at least not for themselves, think about their own small kids at home, because you can harbor the infection and asymptomatically as well transmit it to your kids who are under the age of 12 or the kids who are unvaccinated so far. Studies so far from the medical perspective, I can say that masking definitely helps. We have had healthcare staff doing 12-hour long shifts with a much more robust mask, like an N95, which is much more stronger than surgical masks. And they have put the pulse oximeter, which is a device to check the oxygen saturations. It doesn't fall at all. So obviously, even putting in and working with the mask on, which has much more durability, does not really affect your oxygen saturations. From the medical perspective, I would say that it's perfectly safe to wear a mask, and I think that will create an atmosphere in which kids will remain safe. They won't get the infections from others or not take it home, or vice versa, taking it from home into the school arena and giving out to others. And Pfizer is working diligently for vaccines over the age of 6 months. Moderna is also going to work on, but they are a little bit higher group between age 5 and age 12. But both of these companies, in addition to, of course, J&J and other vaccine companies, are working for it. And the CDC and the FDA are working out for the approval process. And I think before the end of this year, we will have at least an emergency use authorization for those kind of vaccines under the age of 12. Well, first of all is of course, you cannot mandate anything on people. The biggest thing which I do is I ask the question why. And the best thing to do is ask them, okay, why is that so? And when I get a specific question from them, I try to answer that question. Now, just recently in the last couple of weeks, we saw Pfizer vaccine getting a complete and a full authorization. There are still so many people who are not willing to take the vaccine, irrespective of their full authorization. The biggest thing which I'm seeing is that it is introducing certain things in your body which either going to cause you to have cancer, infertility, or it's like kind of a tracking device. Now, having a small particular protein subunit of an inactivated vaccine vehicle is completely innocent to get into your body. It dies within a few hours of it being in your system. It just trains your memory cells and your white blood cells and defense mechanism to fight it when it comes knocking on your door. So the biggest thing I can say is like, trying to see that, when you have a killed particle of a protein subunit, which actually trains the virus to to produce more cells of it, you can imagine the minuscule amount of stuff entering into your body. And that too, having a completely killed, inactivated vehicle in which the vaccine is given is completely safe. In fact, people have not heard much about the mRNA vaccines because they were never used before. This is just a novel way. And in fact, among all the vaccines we have so far, I can tell you, science has shown that these are the safest vaccines ever. Will there be side effects? Rarely, yes, of course there will be. There's nothing in this world which does not have side effect. Even a plain Tylenol has side effect. But again, looking at the risks and benefits, I think it's way, way easier for you to get the vaccine and prevent yourself and your loved ones from getting this dreaded infection, because the virus does not differentiate. We have seen weird things. We have seen 30-year-olds, marathon runners, succumbing to the infection and dying from it. And probably even a 65-year-old who has COPD and is a smoker still making it out. So there's no way to differentiate who is going to live, who's going to die. So I think the best bet you can make is getting the vaccine and then hoping for a mild infection, which usually happens.